Hello students, welcome to my YouTube channel Medico Education. Today we are going to study about hemorrhage. In simple words, you can say hemorrhage is bleeding. So let's study what hemorrhage is in detail. Definition: bleeding or the abnormal flow of blood. As I have told you earlier that in simple words we can say hemorrhage is bleeding. So, abnormal flow of blood can cause hemorrhage, or the meaning of hemorrhage is a copious or heavy discharge of blood from the blood vessels. The blood vessels rupture, and the blood from the blood vessels discharge out in a copious amount that will be causing hemorrhage. There are two types of hemorrhages, that is internal and external. The internal hemorrhage is seen in the image on the elbow of a person. It is basically a bruise. A bruise can be called internal hemorrhage, while when there is a cut in skin and the blood spurts out of the skin and we see the blood out of the body and on the skin, we can say this is external hemorrhage. Internal hemorrhage. Internal hemorrhage, also known as a hemorrhaging, is bleeding that occurs inside the body when a blood vessel is damaged. So basically, internal hemorrhage is related to being inside of the body and not coming out of the skin. When a blood vessel is ruptured or damaged, the blood is coming out of the blood vessels but not out of the skin. Staying into the skin and out of the blood vessel is bruising or internal hemorrhage. Very minor hemorrhages, such as small, ruptured blood vessels near the surface of the skin, are common and usually only produce tiny red specks on the skin or minor bruising, as shown in the image. External hemorrhage. External bleeding happens when blood exits through a break in the skin. Blood loss from bleeding tissue can also be apparent when a blood exits through a natural opening in the body, such as the mouth. External bleeding is basically when the skin is broken and the blood is coming out of the skin, and you can visualize that blood and you can see that blood. That is external hemorrhage. You can also see the blood from coming out of the natural openings in the body, that is mouth. If a person experiences hemorrhage, he will be undergoing the following symptoms: very low blood pressure, rapid heart rate, sweaty, wet skin that often feels cool to the touch, little or no urine, vomiting blood, loss of consciousness, leakage of blood from the eyes, ears, or nose, organ failure. Hemorrhage can be fatal and the patient may undergo organ failure. Here we are describing three characteristics of bleeding, that is arterial, venous, capillary. These characteristics are also shown in the images to make you clear about what they are. In arterial bleeding, if an artery is ruptured, there is a rapid or profuse blood, most difficult to control. It will not be easy to control. Venous, steady flow, easy to control. Or if a vein is damaged and the blood comes out, it has a steady flow and easy to control. Capillary, when a capillary is damaged, it will be slow and oozing blood coming out of it and it controls spontaneously. You do not need anything to do with that, so it controls on its own spontaneously. Bleeding control. Normally, bleeding takes 10 minutes due to coagulation. So, bleeding controls naturally in 10 minutes due to coagulation. Here, I heard the word coagulation. Do you know what coagulation means? Coagulation or clotting is the process through which the blood changes from a liquid and becomes thicker like a gel. This is called coagulation. Coagulation can be, in simpler words, called clotting. Whenever you cut your finger with anything sharp you touch, it stops naturally. The liquid blood that comes out of that cut changes into a gel spontaneously in 5 or 10 minutes and the bleeding stops. This is coagulation. Control of bleeding. Cover the wound with a sterile gauze or a clean cloth. Press on it firmly with the palm of your hand until bleeding stops. But don't press on an eye injury or embedded object. Don't press on head wound if you suspect a skull fracture. You don't have to press it firmly because eye is really very sensitive. Pressure points. Point where an artery can be pressed against a may help. So, pressure points are really very helpful if you know where the pressure points are. So, let's discover where we can find pressure points in our body. In this image, you can see the pressure points you can find in our body. The number one is temporal, carotid, facial, radial ulnar, brachial, subclavian, and femoral.